your presentation, you talked a lot about telemedicine, and we actually have a poll question for the audience that we want to ask them about their perceptions of how would it feel if your visits were predominantly virtual. And we're very curious to get everyone to answer this question. And one of the things that just to let everyone know as you're answering this is that we're also going to ask the healthcare professionals the same question, but from their perspective. And we're curious to see if how close you're aligned to their perceptions of virtual visits. As Maria showed, some of the surveys that have been done online have actually shown a bit of conflicting data. So let's see if we can kind of flip back. Perfect. We can get a sense of, yeah, so this is, you know, what's really interesting is that there's very few people who have been very dissatisfied or somewhat dissatisfied. It's essentially been, you know, Maria, exactly what you've kind of described. And just out of curiosity, from your perspective, if you were filling out that survey, how would you rate your experiences with virtual care?
Well, I have experience on both sides, right? I mean, I see patients, as I said, I've been wanting to do this for a long time, and unfortunately, here in the United States, you can only do what gets reimbursed, right? And I always felt unhappy at the idea that, you know, it was calls after calls from patients. You're answering calls, you're answering emails on the fly, not really giving it the real thought process that would be ideal. And so this is kind of the best of both worlds. You get to see a human being. You get to interact with them like just one-on-one. You know, there's a lot of distraction when I'm in clinic. There's a lot of people asking questions, moving around, talking to each other. Here it's just one-on-one, and again, a much more reductionist way, in a positive way. And so if it allows you to focus on the problem that the patient is experiencing. So I love it. I've also seen doctors, you know, like have seen my doctor in a telemedicine encounter. And had I gone to see that doctor, it would have been like about 3 hours of my life would have been taken up in that visit. In fact, I was like racing around like a mad woman, thinking, oh my God, I have exactly 40 minutes to get there, and you know, based on traffic. And then I got this text message saying that it was a video, it was a televisit, right? I was like, it was like the happiest moment, and it was such a relief, right? No fighting traffic, and that the sort of the anxiety of, will I make it in time? You know, how embarrassing if I don't make it in time, and all that jazz. So I think it's really going to stay with us, please God. And you know, again, in the United States, they are worried about. I'd love to hear really what's happening in Canada, because they're tying themselves up in knots about what will or won't be reimbursed. There's like this magic date at the end of May that this is going to be rolled back. I mean, how dare they, right? My hope is that patients will have enough clout with insurance companies that they will force the issue. It should never go back to the way it was. You know, this should really be something that is covered by their insurance to do these televisits.
Well, it's excellent that you brought that up, because in Canada, the majority of physicians are fee-for-service, so they bill, and billing is direct patient contact within a clinic. So when the pandemic happened, there actually weren't, for most jurisdictions, billing codes to address, and if there were, they were reduced fees and they were capped. And so, for example, in Alberta, there was a huge legislative change to allow the billing codes to actually count for virtual. And they just announced, actually just in the last, I think, week or two, that they're going to take these temporary billing codes and actually extend them to become now, at least what it sounds like, permanent billing codes. So our capacity as we open up and allow more patients back in our clinics, at least in Alberta, and I think this is happening in many jurisdictions across the country, that we are actually going to be able to bill for these virtual visits. And that's going to help, you know, part, like you said, I mean, a lot of that is the economics of it is driving the healthcare delivery.